Hello, and welcome to the journey of researching pharmacodynamics. My first stop on the road trip to research was at the clinicaltrials.gov, better known as ct.gov, where I followed the steps suggested by my teacher and typed in pharmacodynamics into the others search bar. 8,392 studies popped up. I started filtering through and learning that there are some that have results, some that are completed, some that are still recruiting, some that are active. So I started playing around with the filter. I filtered out the completed ones. I filtered out age groups and female, males, and it brought me into the rabbit hole of research. So here's where I took a step back and I stopped for a few hours. When I returned, I decided to do my original search of placing pharmacodynamics in the others search box. And then I just simply clicked on completed studies. That brought me to 5,458 studies. Then I chose my birthday number, 24, and went to that study. And the study that popped up was a diabetes mellitus study, type 2 diabetes study, specifically on the epagliflozin, and the responses of pharmacodynamics and pharmacokinetics in an AM dose versus a PM dose. The title of the study is The Effect of Morning versus Evening Administration on the Pharmacokinetics and Pharmacodynamics of empagliflozin. The summary of the study is that it was an open label, one-way, two-period comparative study to determine the morning versus evening effect of administering empagliflozin 10 milligrams and the effects of the pharmacokinetics in healthy adults. This study was conducted in Egypt, and this intervention is not FDA approved. The study began October 1st, 2018, and the primary completion date was October 19th, 2018. The study completion date was October 26th, 2018. The inclusion criteria for the study was that the subject must have been at least 18 to 45 years in screening, body mass of 18 to 35 kilograms per meter squared. Subject must not be a smoker or not smoke more than 5 cigarettes a day. They are willing participants and give their final written consent prior to the commencement of the study procedures. The subject must be in good age-appropriate health condition as established by the medical histories, physical exams, and results of biochemistry, hematology, and urine analysis, testing within 4 weeks prior to the study. And last, the subject must have normal blood pressure and pulse rate according to the reference normal ranges. The exclusion criteria was rather extensive, having included renal diseases, cardiovascular disease specialties, pancreatic disease, including diabetes, abnormal laboratory values, positive HIV, history of current drug abuse, alcohol or solvents, autoimmune disease disorders as Graves' disease, and so forth. A small description of the study includes an interventional study, single group assignment. Total of 16 healthy subjects will receive a single oral dose of empagliflozin at the evening, which is period 1. After 7 days washout period, the same 16 subjects will receive a single oral dose of empagliflozin at the morning time, and this is considered period 2. Both periods in 1 and 2 will have blood samples collected along with urine samples. The blood samples will be centrifuged and the plasma harvested, stored at -80 degrees Celsius. Urine samples will be taken throughout the 24-hour period at 4-hour increments. This is where I stopped to research a little bit. I wanted to know what centrifuged meant. I had heard it before, but was not entirely clear on what it all entailed. So I researched and came to this website where I was brought to an article on centrifugation. After that, I continued my study on looking at the primary outcome measures, the maximum drug concentration in the plasma, the parameters within the primary outcome measures and the time of the maximum drug concentration in the plasma. Then I stopped to research again. I wasn't quite sure what the Tmax and Cmax in the terms of the clinical studies were, so I found these 3 websites that gave me some insight on the details of what Cmax and Tmax are in clinical studies, one of them being a scholarly article, the other one being a website, Certara, and the third one was a more descriptive explanation of Tmax, time to maximum, in terms of clinical studies. After researching Tmax and Cmax, I went back to my study and checked out the secondary outcome measures, where I came across the term half-life, and I understand a little bit of half-life of a drug in the plasma world, of drugs in clinical trials, but I wanted to know a little bit more. So I clicked into my research, Googling again, and found a few different, an article on half-life explaining the definition and how the drug loses its effect, and what is the half-life of a drug, and found this on the News Medical Lifestyles. Upon finishing this research, I continued and found I wanted to know a little bit more about diabetes, the medications, the medication that was being prescribed. So I went and dove into some more research and found the chemical name, which is Jardiance, for the empagliflozin. I went in to research what empagliflozin was, and also researched a little more on empagliflozin in terms of diabetes and studies. Thank you, and that concludes the journey of researching pharmacodynamics. Thank you.